Today I'm going to talk about continuous glucose monitoring and how it impacts medication management in primary care. I'll be using the Dexcom CGM system as an example along with its provider platform Dexcom Clarity. Dexcom CGM is a wearable device that continuously tracks glucose levels throughout the day and night. Patients can see their glucose readings in real time on their phone, and that same data is uploaded to Dexcom Clarity, which is a secure platform that providers can access remotely. Instead of relying solely on fingerstick logs or waiting for an A1C result, we're able to see glucose trends as they're actually happening. From a primary care standpoint, this technology is very helpful for both follow-up and medication monitoring. Providers can review glucose patterns during office visits, but they can also review data between visits, especially if a patient is experiencing symptoms or has concerns. This allows for more timely and informed medication adjustments rather than waiting months for lab results. In my current role, I complete diabetic assessments for patients with A1C levels above 9 and provide recommendations based on my assessments. Clinically, I've noticed a notable difference in glucose control on follow-up labs in patients who work collaboratively with their providers and begin using continuous glucose monitoring, compared to patients using traditional fingerstick monitoring where glucose values are self-logged without provider monitoring. One of the biggest benefits of CGM is improved safety. Continuous monitoring helps identify patterns such as frequent hypoglycemia or significant glucose variability that may not be apparent from an A1C alone. It also tends to improve patient engagement since patients can see how their medications, meals, and activities directly affect their glucose levels in real time. There are some risks to consider as well. CGM readings can occasionally be inaccurate, particularly with sensor compression or rapid glucose changes. Additionally, some patients may overcorrect based on individual readings rather than looking at overall trends, which can negatively impact glucose control if appropriate education is not provided. CGM data can help guide medication change by showing repeated overnight hypoglycemia, for example, in a patient taking insulin glargine 30 units at bedtime. Based on those documented trends, the basal insulin dose may be reduced to 24 units nightly to decrease hypoglycemia risk while still maintaining adequate glucose control. What makes this technology especially impactful is that medication decisions are supported by objective continuous data rather than patient recall alone. This supports safer prescribing decisions and allows for more individualized dose adjustments, which is particularly important in the management of chronic conditions like diabetes. Overall, continuous glucose monitoring has become a valuable tool in primary care. Platforms such as Dexcom Clarity allows providers to make more informed pharmacotherapy decisions, improve patient safety, and intervene earlier when glucose patterns are not optimal.